Bronchitis, prepared by Joy Reyno and Julia
Vanessa
Raneva.
is an industrial painter who has been smoking for 10 years and has been recently diagnosed with bronchitis.
Bronchitis is airway inflammation and obstruction of the bronchial tubes and bronchioles, associated with irritation from smoking, occupational exposure, and recurrent infection. The major symptoms are coughing, excessive sputum, difficulty breathing, muscle ache, and cyanosis.
The entire respiratory system is lined with ciliated pseudostratified columnar epithelial cells and mucus-secreting goblet cells. Airway mucus, which is carbohydrate-rich proteins, is a complex substance that forms a protective barrier lining the respiratory tract. Bacteria and other airborne particles become trapped in this sticky mucus and then swept upwards and outwards by cilia. Final clearance is accomplished by a combination of coughing and swallowing. In healthy individuals, rates of mucus secretion and clearance are in homeostasis. The consistency of mucus is balanced, thick enough to trap bacteria and other inhaled particles, but thin enough to move easily by cilia. When airways are kept free of bacteria, other particles and excess mucus airways remain open and permit normal exchange of vital oxygen and carbon dioxide. With the inhalation of smoke, the beating of the cilia slows down, and over time the cilia becomes paralyzed and eventually disappears. Without proper cilia function, the result is a continuous blanket of mucus lining the airways that is difficult to mobilize and swallow. This thick mucus layer provides a substrate for bacterial growth, which can release toxins that further damage the cilia and epithelial cells. Eventually, ciliated cells are often replaced by goblet cells as bronchitis progresses. As the cilia no longer effectively removes mucus, an individual must cough it up. The constant coughing tends to be a combination of airway inflammation, excessive bronchial secretions, and increased cough receptor sensitivity. When airflow obstruction is advanced, the decreased expiratory flow leads to an ineffective or unproductive cough as the mucus or phlegm is not efficiently removed. Consequently, patients display mucus retention in both the small peripheral airways and large central airways, which increases the risk of acute viral and bacterial infections. The inflammatory cell recruitment to the airways likely involves chemotactic agents derived not only from tissue fluid and invading microbes, but also generated by the diseased bronchial epithelium. The inflammatory process begins with a chemical alarm. Inflammatory chemicals are released by injured or stressed tissue cells and immune cells. The mast cells release interleukin 4, 5, and histamine, which attract macrophages. Once activated, the macrophages release cytokines and interferon gamma. Such chemicals, kinase, prostaglandin, and complement, dilate local arterioles and make local capillaries liqueur. In addition, many attract leukocytes to the injured area. Inflammatory chemicals also increase the permeability of local capillaries, leading to an exudate causing the surrounding tissue swelling, which is presented by thickening of the wall. The continuing inflammation of the airway walls leads to structural changes including hyperplasia and hypertrophy of goblet cells, mucus glands, and consequential thickening of the airway walls. Thickening of the walls narrows the passages, increasing obstruction to airflow, and hypertrophied mucus glands secrete excessive amounts of viscous fluid. Excessive mucus production leads to even greater restriction of airflow. Such damage to the bronchial defense mechanism in turn promotes bacterial invasion, bringing about recurrent or continuous infections. Structural changes in bronchi alters respiratory ventilation, may lead to undesirable consequences such as hypoventilation, hypoxemia, and respiratory acidosis. For example, respiratory acidosis is presented by accumulation of carbon dioxide in the blood, increased carbonic acid level, drop of blood pH due to slow, shallow breathing. Summary of key concepts. To maintain homeostasis, mucus secretion should be thick enough to trap bacteria and thin enough to be moved by cilia. Thus, airways are open and permit normal exchange of vital oxygen and carbon dioxide. Proteins involved are inflammatory chemicals and mucus itself, which is carbohydrate-rich protein. Cell membrane changes include paralysis of cilia, goblet cells hyperplasia, and mucus gland hypertrophy. For Vanessa, smoking cessation is an essential factor in treatment.
The cough will subside within weeks or months. However, damage to the bronchial tree is irreversible and retreatment is mainly symptomatic, consisting of bronchodilators and prophylactic antibiotics.